For my presentation, I will be discussing the benefits of blood flow restriction training. My name is Fernando Santana, and I'm currently an undergrad student here at Idaho State studying sport management. And once finished, I plan on applying to the master's program for athletic training. So, a constant that all five of my research studies had was the process used for blood flow restriction training. The first one would be the assessment of injury, and this is just to see if blood flow restriction training, or BFR, was would be a viable form of rehab. Next would be devising of the plan of care, and in this, a medical professional would come up with an exercise regimen for the patient. Then we would move on to determining the best tourniquet for the limb, and in this, there are two parts. The first part being the testing for limb occlusion pressure by using a Doppler, and that's basically just testing for blood pressure to know what pressure to set the cuffs at. And then the other part of this would be determining the best cuff, and it is advised to use a wider cuff set at a higher pressure. And then from there, we would move into the exercise plan, and this would be executing the regimen that was given by the medical professional, and following would be the recording of the results and repeating the methods. So with all this, my stance on blood flow restriction training is that it can be very beneficial if implemented properly. And something interesting that I found through my research was the study conducted by Crisafulli and colleagues in 2018, and he was testing for um, mean arterial pressure, and it was found to be reduced with the use of blood flow restriction training. And other key components that were found in my research are the use of blood flow restriction training after regimens was found to increase muscle mass, increase neuromuscular response time, increase strength with less stress on joints, rehab injuries with less stress on joints, accelerate the rehab process, and of course, decreasing blood pressure. And in my chart, you can see here, and the study done by Bowman and colleagues in 2019, they tested the effect of blood flow restriction training while doing knee extension exercises. And you can see in the results the significance of using blood flow restriction training. There is a pretty big gap in between those percents. So it's very evident from this study alone the benefits to be had. All in all, blood flow restriction training has been overlooked for many years because it is relatively new, so it's pretty foreign to many. It's a far concept that not many people are really willing to wrap their heads around, when in all actuality, it can give many benefits, taking away a lot of risk. So that is my presentation. If you have any questions, I will be glad to answer those. Thank you for your time and attention.